Hello, this is the Meguro Counseling Center in Tokyo, Japan. Today we'd like to bring you an educational video related to borderline personality disorder, also called emotionally unstable personality disorder in the EU. Along with most personality disorders, the criteria for this disorder is somewhat unreliable, nonspecific, and it overlaps with many other disorders, for example, ADHD, depression, various other types of mood disorders, and bipolar disorder, and stress reactions. The problem is that the diagnosis and the diagnostic criteria in the nomenclature of the American Psychiatric Association is somewhat politically motivated, and there are groups who have studied this diagnosis and other personality diagnoses for many years, mainly psychodynamic and psychoanalytic groups, who are very reluctant to give up the names of something they've been studying for many years. And it has become embedded in our mental health culture. The reason to have a diagnosis is not so much as clinical study, but as much as needing to have a name of a disorder to bill an insurance company. Unfortunately, the names of these disorders do not always serve the patients in the best way. In addition, the types of treatment for this disorder, for example, cognitive behavioral therapy or dialectic behavioral therapy, these treatments are really unproven types of interventions. They don't have single blind, which is a patient blind, or a double blind, which is a patient and a therapist blind, or a blind placebo, so that the control of these studies is somewhat questionable. In addition, we might propose that it would be better to label exactly the behaviors and symptoms the patient shows rather than the name of something which is now attached to some kind of stigma. For example, if a person has interpersonal problems, why not give them a diagnosis of interpersonal stress reaction? If they have self-harm behavior, we could propose diagnosing them as having self-harm behavior disorder. If they have trouble with their moods, we might diagnose them as having intermittent dysphoric disorder. These are absolute descriptors of what the patients show. There is little stigma to having a name of that kind of problem because it can be proven. That's what they've presented to the clinic with, and they could still be billed for that through their insurance, and it would decrease stigma, and especially the stigma and discrimination associated with the term borderline personality disorder. We thank you very much for watching this educational video.